Hello, I'm Alex Chapman and I'm Chair of Ethiopiaid. I've been involved in the charity since 1989 when my father, Sir Alec Reid, founded Ethiopiaid. I've had the great pleasure of meeting many of you over the years on trips to Ethiopia and last summer at our 30th year anniversary. I hope you're keeping well during these strange times and keeping connected to family and friends, and I'm sorry I'm not able to meet you personally at the moment. As you know, Ethiopiaid works in long-term partnerships amongst some of the most vulnerable and marginalised communities in Ethiopia. Our partners are facing enormous challenges at the moment. Prolonged drought, swarms of locusts decimating and devastating crops, and now the COVID-19 pandemic. Although numbers of cases are not as high as first predicted in Africa, cases are escalating and the impact on the economy and livelihoods is devastating. In the face of these enormous challenges, I've been so impressed how our partners have stepped up to support the communities they work with. One such partner is Healing Hands of Joy. Healing Hands of Joy work with fistula survivors to rehabilitate them and train them to become safe motherhood ambassadors. They then return to their villages and train other women in safe birthing practices and antenatal care.
Okay. My name is Masalati. I am the country director for Healing Hands of Joy in Ethiopia. And Healing Hands of Joy is working with women after a fistula treatment on their rehabilitation and reintegration. And the most rewarding of all is to see these women happy on the day of their graduation with a much more improved self-esteem and motivation to make sure that when they go back, no other woman goes through the same experience, and they support these women in both identification of new cases that have been hiding and have not had a chance to get the treatment like they did, and also prevention in helping pregnant women go do the antenatal care follow-ups and give birth at health facilities. So the commitment of our Safe Motherhood ambassadors, in addition to the change that we see in their lives upon the completion of this program.
We have just received this report from Meselet on how they are supporting their community at this time. COVID-19 has impacted our work in that we can't have women come to our centres and go through Safe Motherhood Ambassador training programme as of April. Sadly, we had to close our centres and had to send all our staff home, and there were restrictions on movements even within the same region. Soon after that, we redesigned our programme in such a way that we can still reach women individually and follow up on their reintegration. We also were able, with the support from Ethiopiaid, to provide emergency food and essential items such as wheat flour, cooking oil, soap and sanitary materials to those Safe Motherhood ambassadors in most need. These are women who have no one to turn to and nothing to eat at this difficult time. The major challenge has been restriction on movements within the regions. We are hearing that more and more pregnant women are deciding not to come for antenatal care and ending up giving birth at home. We are worried this might lead to obstructed labour, which in turn might lead to obstetric fistula. We are working to help Safe Motherhood ambassadors to continue reaching pregnant women with safe birthing advice, identifying women with fistula, while sharing basic information about prevention of COVID-19. This is just one example of how our partners are stepping up to help during the crisis. We are confident with your help that we can provide the support that is needed now and during the aftermath. We want to ensure that recovery is resilient, just and sustainable. Our response to COVID-19 and the other economic and environmental challenges is very much in line with my father's first inspiration for the charity. When he visited Ethiopia in the 1980s, he was struck by the wealth of entrepreneurial skills and expertise amongst local Ethiopian organisations. For 30 years we have been working with these organisations to have the greatest impact. Thank you for the vital role you play at Ethiopiaid. Without you, none of this work would be possible. People's lives are being transformed by your generosity. So a huge heartfelt thank you from myself and all the team at Ethiopiaid.